Hello, my name is Dr. Raj Shah, and I'm an associate professor in family medicine and the Rush Alzheimer's Disease Center at Rush University Medical Center. One of the things I wanted to do today is to give an overview about mental health first aid. Why do we need to consider mental health in providing holistic care in primary care? What is the role of mental health first aid and its goals? And how can individuals that are in training in family medicine and in their early careers and later careers in primary care be involved as advocates for mental health first aid? So the first thing about the why mental health first aid, it's been very clear for a long time that mental health and mental illnesses are very common in the United States. It is almost 1 in 5 individuals that live with an anxiety disorder and a significant amount of people with major depression, bipolar disorder, and schizophrenia. Many of these conditions start early when people are in their young adulthood and then last and have ramifications throughout their lifetime. We know that mental health results in stigma. And it's stated that about 50% of all adults believe that people are caring and sympathetic to persons with mental health. However, when we interview individuals experiencing a mental health illness, only 25% of adults with mental health symptoms believe that others were caring and sympathetic to them. This disconnect of people with mental health feeling ostracized or stigmatized by their community and not included has led to a significant gap in life expectancy for those with serious mental illness. The life expectancy gap is ranging to greater than over a decade between people who have serious mental health illness and those that do not. So there's lots to do, and there's a role about how we can engage all of our community members to be more aware about the needs of persons with mental health issues and how we can learn and support them if they're in a crisis. The history of mental health first aid was that it was developed initially in Australia in 2001 by Ms. Kishner and Dr. Jorm, who were husband and wife, and they were thinking on a walk about how they could go about encouraging more individuals to be aware of the signs and symptoms of a mental health crisis, and then as laypersons to offer support until professional help can be provided. They did a lot of the early studies around the intervention and the program development. And eventually the program has spread to over 22 countries. And in the United States, Mental Health First Aid USA is the prime organization for the training and support of mental health first aid. And the basics of mental health first aid are to essentially, in a day-long course, sometimes it can be anywhere between 6 to 8 hours. Sometimes they divide the course in 2 4-hour segments over 2 days. But it's really to give people in the community the skills to help somebody who's developing a mental health problem or experiencing a mental health crisis. There are different versions of mental health first aid. There's one version for the needs of adults. There's another version for the need for older adults, and another version for the need of young persons, including children and young adults. There's also versions that are in Spanish that are offered. And recently, with the inability to always meet in person for these sessions, there's been a virtual online version being offered. The goal is really to do something similar to what cardiopulmonary resuscitation or basic life support training does for cardiovascular disease. And it's to help a person with no clinical training assist an individual experiencing a mental health crisis, such as thinking about suicide. And it's really meant to not for that mental health first aider to be a Cape Crusader, as a common message was given in my training, but to help them to understand what the situation is, to create a safe environment and a supportive environment for the person experiencing the mental health crisis and help that person through that moment until appropriate professional help can arrive. And there's been a significant amount of evidence around the program that's developed since it was introduced in the early 2000s. There have been peer-reviewed studies that have shown the program expands knowledge of mental illness, signs and symptoms, and their treatment. It reduces the difficulties around stigma and social distance for individuals with mental illness by improving mental health literacy. It improves the mental health of individuals administering care and the ones receiving it. It increases the number of support services that are recommended and provided. And for those that are contemplating suicide, it can be a lifesaver in helping to stop the chain and providing support for a reframing of what is happening in the moment. The topics covered range from what is sort of normal changes in mood and behavior, and then what can be considered to be the signs and symptoms of common conditions like depression, anxiety, post-traumatic stress disorder, psychosis, and substance use disorders. There's a lot of hands-on practicing with the groups when they're held in person, so that individuals can use adult learning techniques to be able to understand the information and apply that to their day-to-day experience. There's also a key mnemonic, like we have one for CPR, and the mnemonic for mental health first aid and the action plan is algae. And the koala, as a symbol of mental health first aid training, is named algae. But ALGE stands for assess for the risk of suicide or harm to make sure if you're in a crisis situation or not. Listen non-judgmentally to the person experiencing the condition, give reassurance and information, and then encourage appropriate professional help and self-help and other support strategies. And there's a lot individuals can do to advocate for mental health awareness, especially family physicians in training as students, as residents, and then eventually as practitioners in a community. One way is to take the course themselves so that they can understand what is being trained and feel more confident about their abilities in community settings to recognize if somebody is having a crisis and to offer some of the basic first steps. People can then advance to thinking about becoming an instructor like I did to get the appropriate certification and training to be able to offer mental health first aid training. And then there could be a broader ask with the organization that you work with to sponsor an instructor training for a group of individuals so that more people can get trained and more people have the opportunity to learn about mental health first aid and to apply it into their day-to-day lives. Thank you.